Alright, hey, my name's Michael. I'm gonna be a nurse tonight. How are
Nice
you?
to meet you.
What's your name?
Bobby.
Bobby, nice to meet you. Okay. I'm gonna be doing a head to toe assessment on you this evening, okay?
Okay.
Alright. Alright. First, what I'm gonna do is get you to tell me your name. What's your name?
Bobby Pritchard.
Yeah. And how old are you, Bobby?
I'm 45.
Okay. Where you at right now?
In terms of what?
In terms of, like, where are we here right now?
Oh, we're in the hospital.
Yep, that's right. Yes, sir. And what day is it right now? What day and month?
It is December 7th.
That's right. That's right. And what year is it?
It is 2019.
Yes, sir. That's it. Who's president?
Trump.
That's right. All right. I know his Glasgow Coma Scale score is 15 just because I saw him walk in here. He's talking to me. I've been watching him move around. What I'm going to do right now is I'm going to do a full neuro assessment on you, and then I'm going to get your vital signs.
Okay.
All right. All right. Squeeze my hands. I'm going to put my hands right there. Get you to squeeze them as hard as you can. All right. Good job. There you go. All right. Lift your arms up for me. Good job. There you go. Alright, now I'm going to look in your eyes. Normally what I would do is dim the lights before I do this step right here, but we're just going to look in your eyes. I'm looking this one. They're both reacting for me. Okay. I'm going to get you to push against me right here. I'm going to kind of
push.
Alright, so hold my arms.
Alright.
And I'm going to put some resistance against you
Okay.
and push. Alright, good job. There we go. Alright, lift your legs up for me. Yeah, perfect. Alright, you can put it back down. Alright, now I'm going to get you to push against my hands with your feet. There you go. Pull back against my hands with your feet. Perfect, perfect, perfect. Alrighty, so now what I'm going to do is I'm going to get your vital signs, okay?
Alright.
Where's my equipment? Alright, Mr. Bobby, I'm going to go ahead and get your temperature, okay?
Alright.
I'll stick that under your tongue. You sure this thing's working? Yeah, it is. It's just taking its time. Let me look at it. Make sure it's working. Yeah, it is. It's just taking its time. There we go. Alright, 98.5. I just been stuck on that for a while. Alright, now I'm gonna get your blood pressure. I'm gonna hook you up to this right here. I'm gonna hook that up to your arm. I got me an automatic cuff for this. And just rest your arm right there. Perfect. Ordinarily, I would also get a pulse ox, but I don't have that equipment right now. And ordinarily, I would also go ahead and listen to his heart, but I'm going to do that at a later part in the assessment. And there we go. Okay. Let me get this cuff off of you, man. I'll set it on over here. Alright, I did my normal neuro assessment on you, but what I'm going to do now is I'm going to do a little advanced neuro assessment. I'm going to get you to, I'm going to do like assess your cranial nerves.
Okay.
So what I'm going to do, I'm going to go ahead and assess cranial nerve 1. Alright, I'm going to get you to close your eyes, Mr. Bobby.
Alright.
Alright, close your eyes. Alright, tell me what it is you smell right here. What scent?
And mint.
That's right. Okay. Alright, so that's cranial nerve 1. Alright, to test cranial nerve 2, what I'm gonna do, can you tell me what my badge says?
Michael,
Yeah, what's it say under there?
a registered nurse.
Yes, it does. And you look over at the wall over there, tell me what letter that is.
G.
Yes, sir. Do you wear glasses?
I do not.
Okay, perfect. Alright, now what I'm gonna do is I'm gonna test your accommodation. I'm gonna use my pen. Alright, so here's what I'm gonna do. I'm gonna get you to look at this pen, okay? So look at the pen,
Mm-hmm.
then I'm gonna get you to look at the wall. Alright, now look back at the pen, and look at the wall. And what I'm doing right here is I'm testing his accommodation. So this is, what the eyes should do is they should dilate whenever he looks at the wall, and then they should constrict whenever he looks back at this pen. Do it one more time for me. Pen, wall. Okay, perfect. Now what I'm gonna do is I'm gonna test convergence. So I'm gonna hold this pen out, stare at it, and I'm just gonna move it towards your face. Follow it with just your eyes. Perfect. Okay. There we go. Okay. Now what I'm gonna do is I'm gonna take this pen out again, and I'm gonna test your 6 cardinal fields of gaze. What this is doing is this is testing 4 and 6, cranial nerve 4 and 6. All right. So what I'm gonna do? Yeah, sit up straight for me. I'm gonna get you to look at this pen. All right. So follow with just your eyes. 1, 2, 3, 4. All right. There you go. Yep. That tests cranial nerve 4 and 6. So now what I'm gonna do is I'm gonna test cranial nerve 5. Alright, close your eyes for me, Mr. Bobby. Alright. Tell me which side of your face that you feel it on.
My left.
Yes, sir. And how does it feel? Tell me, does it feel like it's poking you? Does it feel hard?
It feels soft.
Yes, sir. Alright. That tests cranial nerve 5. Now what I'm gonna do is I'm gonna test cranial nerve 7. Alright, smile for me. Frown. Raise your eyebrows. Puff your cheeks out. Alright, stick out your tongue. There you go. Perfect. It's cranial nerve 7. Now what I'm going to do is I'm going to test cranial nerve 8. And we do that by this right here. It's called the whisper test. Alright, so what I'm going to do is I'm going to occlude one of your ears. I'm going to occlude this one, and I'm going to whisper some words, and I'm going to get you to tell me what I said, okay?
Okay.
Alright. Okay?
Cat, dog.
Yes, sir. Alright, I'm going to do the same thing over here. Okay.
Apple, banana.
Yes, sir. Alright, now what I'm going to do with cranial nerve 10, I already know it's intact. He's speaking clearly to me. He's not having any slurred speech or difficulty with his speech. So now what I'm going to go ahead and do is I'm going to test cranial nerve 11. Alright. Shrug your shoulders against me. Against resistance. There you go. Okay. And I'm also going to get you to move your head side to side for me. Just like that right there. That's perfect. Yeah. Alright, now I'm going to test cranial nerve 12, which is the final cranial nerve. I'm going to get you to stick your tongue out and then move it side to side. Perfect. He does that just fine. Alright, so we're done with the neurological assessment. Now what I'm going to do is I'm going to just assess his head and neck. So I can look, I see, you know, he's bald, but that's normal, you know, in a male his age. He's got no lesions, no abnormalities up here as far as my inspection of his face. His nose is intact. I'm gonna look up there. If you'll just, alright, I don't see any occlusions. I can shine a light in there. Alright, yeah, no occlusions, looks good. I'm gonna look at his ears. Look to be intact there, no drainage or anything like that. Alright, now what I'm gonna do is I'm gonna look in his throat and then I'm gonna palpate his lymph nodes. Alright, open your mouth for me and say ah. Alright, there you go. I'll go ahead and test his gag reflex too. I'm not actually gonna test it, but I would test his gag reflex. That's not very nice, so I'm not gonna do that. Alright. Alright, so now what I'm gonna do is I'm gonna palpate the lymph nodes on his face. Alright, so we got right here. I don't note no tenderness. Okay. I don't feel any swelling. Okay, I'm gonna palpate his jawline. nice even distribution of facial hair there. No abnormalities. Nothing that I'm concerned about. Okay. And I'm gonna palpate these cervical lymph nodes right here. Okay. Make sure I didn't feel any tenderness. Okay. Alright, so now what I'm going to do is I'm going to palpate his axillary nodes. And for this part of the assessment, what I'm going to do is I'm going to get him to take his shirt off. So if you'll just take your shirt off for me, Mr. Bobby. There we go. Alright, so lift your arms up for me. I'm going to feel right here. No tenderness. No tenderness?
No.
Okay.
Not at all.
I don't feel any swelling. So now these are the axillary nodes right here. Okay, can you get a good view of this? I mean, I think you're fine. Yeah, so this is the axillary nodes on the right side, and the same thing over here on this left side. No tenderness over here?
No.
Okay. Alright, I'm gonna palpate the actual axillary nodes. I don't feel any swelling. No signs of tenderness. Okay, you set your arms down for me. Alright, so now what I'm gonna do is I'm gonna auscultate his lungs. I'm just gonna listen to your lungs, Mr. Bobby.
Okay.
It's 26 areas is what I'm gonna listen for. I'm gonna see if there's any, make sure that they're clear, make sure his chest is expanding. I'm gonna make sure that there's no crackles, no wheezes, no adventitious breath sounds of any sort. Alright, so I'm gonna start on your back. Number one. You wanna come? Well, nah. I'll just tell the camera what I'm doing. Alright, so take deep breaths for me. Alright. 1, 2.